Good morning, Donna. So nice to see
Hi,
your
Melissa.
face.
I made it.
You made it, and you have a new dryer today too. So that is awesome.
Indeed, I do.
You know you're an
How
adult
are
when you
you?
get excited about that stuff.
Oh, yes. It's the little things.
Yes. So where are you located, Donna?
I am in Manhattan and in Rutherford, New Jersey.
Oh,
So I have two offices.
do you have snow this morning as well?
Yes. I didn't have any idea. Did you know? Where are you?
I'm in Providence, Rhode Island.
Oh, did you know it was coming?
They said like a dusting to an inch, but there's like 3 to 4 inches out there.
I know. I was shocked. I had no idea. I'm trying to get my face in, like, so I'm not, the head that ate Cleveland here. Oh, my God. All right. I think that's better.
So what do you do in your practice, Donna?
I specialize mostly in addiction and codependency issues, those kinds of things. And I have a few people working with me, a few interns. I've been doing this a while, but privately 10 years or so. Before that, I worked in the public sector for a really long time. And I have
nice. Now, how does it work with your interns? How does that go for you?
It's good. It can be challenging. I mean, it's a lot of work, because you're teaching them so many things, business aspects of it, of the practice, as well as clinical. So it is a lot of work, but I mean, I like it. I like teaching.
Yeah. And do you pay them a fee for the services they're providing, or is it just
a small fee in addition to their hours for licensure, which is so crazy these days? I didn't have to do that. I don't know how people, manage to get so many hours. It's like getting a credit card, It's like you can't get credit till you have a credit card. It's to get a job. It's so difficult for them. So they're happy to, get that part, the clinical hours.
Yeah, I mean, it is really difficult. I remember that I had to try to find my internship, and of course it wasn't paid. And so you're working a bazillion hours a week just to get all your hours in and to be able to survive.
Yeah, it's really hard.
Yeah, I don't think I could go back and do it right now.
No, I know I couldn't. I can't imagine. So
do you work with your interns, like working around addiction and stuff like that, or do they have their own specialty?
It's whatever the presenting problem is, it's not so much they have their own specialties, they're finding their way kind of thing. So it's whatever, the patient comes in with. At this point, I am trying to disengage from insurance entirely, So that's one issue. Yeah. When I started part-time practice, when I was working as well, managed care had just hit, and it was like, unless you got on a panel, you didn't work. So I got on some, and now it's like gum on my shoe, like go away. It's really, you get involved in that. So I'm really working hard at that. Yeah,
it's really, really difficult because there's a stigma to it too, because other people might not want to refer to you if they know that you don't take insurance.
Yes, It's true. That's interesting you say that, because I was looking in my town in Rutherford, which is about 20 minutes outside of Manhattan, I'd say. Not so far. When I started here, there was one other therapist, and she took, I think, one insurance. She was on one panel. And I was noticing the other day, there's about maybe 7 now. And many of them aren't on at all. I'm like, hey, wait a minute. Like, what's going on here? So that was heartening to see, but what you say is very true. There is that kind of, you should be on. It's like almost a moral issue. People deserve versus, I need to make a decent living and I've worked so hard for so many years,
Yeah, and I think that a lot of people who are not in the therapy world think that therapists get paid a ton of money from, like, the insurance companies.
Absolutely.
We're not doctors, and that doesn't happen.
They have no idea.
Yeah.
They don't know. My patients, I know, have no idea that what the insurance company pays me is basically, a third or a little more of what my actual fee is. They don't know.
Yeah.
And it's been around so long now that people expect to just use their insurance too.
Yeah, because they don't know that they don't have to.
Right.
Yeah. It's a really interesting area to kind of figure out how to work that system. I mean, it can be really difficult. And I think like every day we have to figure out how many hours are we going to spend on the phone chasing down a claim that, they might forget about or they might lose, and you may never get paid for that.
Yeah. That's really, when I think over the years how many times that has happened to me, it makes me crazy to think about, but it's the nature of the beast. When I was doing everything by myself, stuff fell through the cracks, and usually it was the money. Why, I don't know.
Yeah, right. Why is that the one that falls through the cracks?
Yeah, right.
So recently we've been having a lot of questions on the Facebook group about trainings. Has there been like a really good training that you've been to that, like, because I know we go to trainings and sometimes it's like I paid this much money for 3 hours of what?
Yeah.
Have you been into any good trainings?
I find what I do regularly is weekly. I go to a study group. I trained as a psychoanalyst, and so I do readings in that area. So it's more like clinical stuff that it's kind of new, and books that are coming out, stuff like that. That kind of thing I enjoy. And writing too. I've been going to a writing group. So I haven't, in recent time, the best thing I did, but it's almost a year and a half ago, was the Most Awesome Conference in San Diego with Zinni.
Yeah.
Miranda and Kelly. And
Joe Stanoff too,
wonderful. Right? And Joe and and Julie Hanks.
Mm-hmm.
Like all my heroes.
Yes.
And
Joe
that was very
coach.
Cool.
Yeah.
Who was Joe?
Yeah. Yep.
Quite an amazing guy. Like,
yes.
I'm like, wow,
And
yeah,
so
very impressive.
What was awesome about the Most Awesome Conference?
It was what I liked. It was very kind of straightforward. There was so much information and concrete help, like things like doing a video, like how Ernesto did the videos for all of us, and kind of hands-on things like how do you do your books, how do you do this stuff that's so important, but they have a very straightforward, clear message.
Mm-hmm.
No blah, blah, blah,
Yeah, it sounds like almost like a how-to private practice conference.
Yeah, it is. It was like that. Mm-hmm. And they're good people and they have a lot of information. So that was the last training that I can think of specifically, I think, that I went to.
And were there any CEUs offered in that?
I don't think so. No, okay. I don't know.
Yeah.
My reading group has CEUs now.
Oh.
So, I do it through there. And I do online things a lot. Mm-hmm. Recently started doing online therapy training. Mm-hmm. Because that's where I want to go next. Although, I don't know if I need to be more isolated by myself. But, it's something new that I really want to try and get information about. So I do that kind of thing, online trainings.
And what do you find to be the benefit for the client for online therapy?
I think accessibility.
Mm-hmm.
For example, tonight I had someone generally comes to see me in the evening call and say she has pink eye, can't come in. She's, infectious, I guess, whatever the word is. So we'll do it online, having that option. But also, I haven't done. I have a lot of research to do about the laws and limitations of cross state and all that kind of stuff. But one of the things about the internet that's like so amazing to me is like I'm talking to you, you know, like, and you're not so far from me, but you know, like chances of me getting to Rhode Island, haven't been there in a while, you know, and this kind of unifying like phenomena that, you know, is amazing. So I feel like it's part of that, like giving me access to people that, and them access to me, you know, that wouldn't have been there before. I think that's really cool.
Yeah. Yeah, I've had great success with the online stuff, especially with people who have chronic illness or chronic pain, where spending 3 hours getting to a session is just not worth their, you know,
Right.
energy. And so it's been very beneficial in that sense.
Yeah, yeah.
Yeah. So have you read any good books lately?
Let's see. The last book I read, the book, this is terrible. It's on my Kindle now. I can't remember the name.
I feel like you probably read a lot of books.
I have read a lot of books, but I really should remember their titles. But then again, sometimes I forget the name for rug. You know, it's like these words just leave my head. Oh, growing older is really a treat. But I can't remember. This is terrible. It's so embarrassing. I do read, though, I swear.
Oh, yeah. So I recently listened to The E-Myth. It's been really awesome. I almost think like even before somebody starts a private practice, they need to read or listen to this book because it really talks about how you have your craft and then you think you should be in business with your craft like we do, like we're therapists. We want to go into private practice, but then there's all these other layers that we don't think about, the manager and being the executive and stuff like that. Yeah, it was a really great book. I like to listen to those stuff on.
Yeah. I like to do that too with the more informational, like nonfiction, which I do a lot of nonfiction reading.
Yeah, me too.
More so than fiction.
I can't read before bed because I get too pumped up. I have like this HIPAA book I'm reading and I'm just like, I can't sleep now.
I saw that. I thought to myself, oh my God, you're going to read about HIPAA? Make me nuts, all this stuff to worry about. And then the HIPAA police will be knocking in your dreams.
I know. I call them the HIPAA ninjas.
I know. Oh my gosh.
Yeah. I just have visions of them like doing flips into the office.
I know. It's like sometimes, you know, when I look at the Facebook conversations, it almost feels like there's so much anxiety about so many things. And part of it is informational, you know, like, you know, learning, you know, and not knowing that, you know, it'll probably be okay, you know. But I feel like worried for people. Like I feel bad that, you know, people go through this, you know. Someone will bring up a topic and you'll see following. So obviously everybody is wanting the same information, you know.
Yeah. And that's why I started the group, because I wanted people to feel supported and be able to share information. And coming this year, I'm going to be doing a membership site where people can come and get certain training, say on HIPAA or working with the LGBTQ plus community and things like that. Yeah. Because I feel like we do feel so isolated. And sometimes we feel like we can't talk to our peers about certain things because then they might judge us, which is strange, right? That we have these feelings, even being therapists.
But it's out. I mean, there's a lot of judging that's going on. Let's be, you know. I was watching yesterday. What is the woman's name? It was on a Marie Forleo training. It's Gabrielle. Can't recall her last name, but anyway, she wrote a book about freeing yourself from judgment, and it was like, wow, like to think about that. When I'm judging someone, it's because of something, you know, within myself. Like I feel I should be doing that, and I get upset with them that they're doing that. Does that make sense? You know what I mean? Yeah. You know, but there is a lot of like, well, no, you should, you know, therapy is a right. People should see, you know, you should be able to see, people should be able to see you for, you know, X amount of dollars, which is crazy low or whatever. Yeah. You know?
Yeah. So what would be one piece of advice you could give new clinicians going into private practice?
Breathe and read and to some degree, do your own due diligence in addition to asking questions. Perhaps do your own due diligence first in terms of research, to the original source, because things get, and I don't mean this to be, it is judgment. I suppose I am judging, like, ethics gets thrown around a lot, the notion of ethics. And I think, when people have anxiety about doing this or that, well, oh no, that's not ethical. Well, let's indeed look at that and see, is it an ethical issue or, what, really get the information, because, knowledge is power. It's true. And fear, I think, is very rooted in lack of knowledge and anxiety.
Yeah.
And it's complicated out there, in our work, like we were talking about in the beginning, getting your hours as an intern, all this stuff that didn't exist before. So
yeah, absolutely. Yeah. So Donna, thank you so much for chatting with me today. It was so nice meeting you.
This was my first time. I'm so excited. I never did Facebook Live. I'm like, I almost didn't sleep. And then the dryer is crazy. But this was a lot of fun. Thank you, Melissa.
And where can people get a hold of you?
I'm at DonnaCorbettTherapy.com, and all my info's there. And as I said, I'm in New York and Rutherford, and you can reach me there.
Nice. And please put your link on the bottom of the post so people can link to it.
Will do.